Hi everyone, it is such a pleasure to be here today to help present to you and to help support this Respite Research Summit. This is something that we've talked about and dreamed about for a long time, and so it's great to see it happening and so many people engaging, even though we are in a virtual setting. I'm Dr. Kim Whitmore, and I'm an assistant professor in the School of Nursing at the University of Wisconsin-Madison, and my program of research focuses on supporting family caregivers of children with special health care needs, and a lot of that centers around respite care and how do we help increase access to and the quality of respite supports for family caregivers. But right now in the presentation, I have the difficult challenge of helping to encourage everyone and create that frame for using equity and diversity focus in our research. And I have 15 minutes to do that. This is something that I could spend an entire course teaching folks about and definitely could talk for hours on. And so this is definitely a very high level, brief overview of an incredibly important topic. We all know that we are facing a double pandemic right now in our country, the COVID pandemic as well as the racism pandemic. And so this is something that has always been important, but I think an increase in importance as we think about everything that's happening in our world today. So I want to really offer some challenges to everyone today and in your future work to help focus their research and work around equity and diversity. And if you want to go to the next slide, we have a quick poll question just to kind of get a sense of the audience, wondering how often does your work currently involve an intentional focus on equity and diversity? So this is great. It's great to see that the majority of people have often or always have that focus. But we know that we really want everyone to get into that always category. So hopefully some of the considerations that I present for you today will help kind of stimulate some of those ideas in your mind and as we go throughout this summit. Next slide, please. So really quick, I want to just clarify 3 important concepts. And these are not textbook definitions. These are Kim Whitmore's plain language definitions of these 3 concepts. The first being diversity, being different perspectives, inclusion being feeling welcome, and equity meaning fairness. Next slide. When we talk about diversity, it's important to remember that diversity, broadly defined, includes a broad variety of social identity constructs, which are listed here. I think we often think about race, ethnicity, and culture, as well as with all the work that we're involved in. I think we typically focus on ability and age as well, but just a recognition that there are many social identity constructs that we need to keep in mind and think about in our research as well as in our programmatic work so that we ensure that we are addressing the needs and having that equity lens across all of these constructs. Next slide. This is a diagram from the Robert Wood Johnson Foundation that I think does a really great job of helping to understand health equity and how in our work we really need to remember that we have to meet people where they're at. And in the top of this diagram, you see that every person is given the same or equal, the same bike, and that is not something that is going to allow everyone to exercise and be healthy in the same way. In the bottom picture, it's representing equity, in which we give everyone the resources that they need in order to be healthy. So giving everyone the right type of exercise equipment, in this example from an individual perspective, is just a nice visual to kind of explain the difference between equality and equity, making sure that we're moving beyond sameness and into what is fair and going to help support health equity as we move forward. Next slide, please. In my work, I've described the importance of respite care also being tailored in order to have positive outcomes and promote equity in our respite outcomes as well. And so as a nurse, we often think of the 5 rights of medication administration, making sure we give the right person the right medication at the right time in the right dose in the right route. And in my dissertation work, I reframed that same concept around respite care, keeping in mind that the right family needs the right type of respite at the right time, in the right duration, and in the right location, whether that be at home or in a community-based setting. And so it's just another way to think about how do we ensure across populations that we are really tailoring respite to promote that equity and giving folks what they need at the right time when they need it most. Next slide, please. And also another diagram that I have focused on from a concept analysis that I developed is presented here. And I want you just to focus in on the centerpiece, and this really builds off the previous concept in that in order for there to be quality respite services that result in the positive outcomes that we're trying to achieve, and in this case, decrease stress and improve family quality of life, it's important that all the different components of respite care services match the unique family needs that are positioned at the center of this diagram. And this diagram and conceptual diagram helps us to think about if any of these elements, if the trust in the provider, if the cost of the respite program, the perceived safety, any of those sort of fall out from that picture, that respite care can often have the opposite effect, that it can increase caregiver stress and decrease family quality of life. And so again, just another thought on how to conceptualize, how do we ensure that there's equitable distribution of respite related services that meet the needs of our broad, diverse constituents when we think about respite services. Next slide, please. And then finally, this is a diagram that I think helps us to understand equity and equality at the community level, which is where most of our service delivery occurs. And so when we think about research, it's important to look at how are respite services distributed and allocated to different populations in our community. If we are providing the same type and the same amount of respite supports and services to all populations at the community level, that's often going to result in inequitable outcomes. So we need to really look at how are our resources in the respite world helping to promote equity at the community level as well. Next slide. So now I want to tie this a little bit back to the key recommendations that Dr. Kirk just presented and help us think about real specifically how we can have that equity, diversity, and inclusion framework in the research that we do. And I feel like if you look at each of these key areas, there are things that we can do to ensure that we are having that equity lens across each of those levels. And I'm going to pose a few considerations and questions to help stimulate some thought around each of those recommendations. Next slide. So this slide highlights some adapted language from a document that we developed at the UW-Madison School of Nursing for our Inclusive Excellence Plan. I'm really fortunate that I'm in an institution that highly values and promotes inclusive excellence across our teaching, research, and service broadly in our campus, but real specifically and intentionally within the School of Nursing. And so we developed a detailed action plan for how we are going to address inclusive excellence and measure our inclusive excellence. And so I have the hyperlink to that reference in the slide for those who are interested in getting some ideas, bringing back to your own institutions. But on the slide, you can see highlighted 5 areas that we really intentionally focus on to ensure that our research is moving us towards inclusive research. The first being that studies are intentionally designed to address disparities or inequities. The next is that studies focus on diverse populations. The third, that they engage community partners in research. And I'm a firm believer that we cannot do anything in our research without engaging those that are directly impacted. So the next recommendation being engaging community advisory boards is one that I am very passionate about, and we have some incredible resources on campus that allow us to support community advisory boards in different ways here. But I think that you may have all heard the term nothing about us without us, and that's something that I think is really important as we think about our research, making sure that we are at all stages of the research process, engaging those who are directly impacted by the work that we're doing. And then finally, making sure that in our dissemination that we are including not just the published manuscripts that we know are incredibly important for advancing the knowledge and the literature, but also ensuring that there are plain language summaries of findings that are given back to the community that they can use to understand the research and use for their own advocacy efforts as well. Next slide, please. And so finally, I just want to share some reflection questions for each of you, and we'll have a few minutes to kind of talk through some of these and hear some thoughts from you. But these are some things that I really want to challenge each of you that are involved in research or as a research partner to think about. The first is your research team diverse, representative of the populations and the people that you work with, and is it inclusive? I think a lot of times we focus on diversity, ensuring that we're getting those different perspectives on our team and in our community advisory boards and with partners that we engage in, but making sure that we take that one step further and think about, are we creating an inclusive environment? Are people feeling welcomed and heard? Are we avoiding tokenizing people by only having one representative from a population being a part of our work? Those are all things that you can think about as you look at the constitution of your research teams. The next reflection question for you is, are you cultivating authentic relationships with diverse stakeholders, including family caregivers? And I'm so glad that we have a few family caregivers with us today. I know many of you also wear multiple hats and work in professional roles and also are family caregivers, but your perspective as a family caregiver is so important, as that of care receivers, making sure that those who are receiving the care are also involved in the conversations, and as well as the respite providers. So when we think about authentic relationships, how are we building trust? What are we doing to continue to build and grow those relationships over time so that we're not just swooping in, asking our research questions, and then swooping out? The third reflective question that I'd like you to think about is, how are you engaging stakeholders at all stages of the research process? Again, I think we often find a way to check that box that we've engaged stakeholders, but it's important to think about, how are they involved from the beginning? Are they involved in helping to frame the research questions, design the study methods, look at recruitment strategies? Are they involved directly in data collection? What role could they play in, maybe not doing the analysis, but validating the analysis and helping with interpretation of findings? And how can they help support that dissemination of your work? And then the next question is, what implicit biases do you or your team need to unlearn to avoid biased data collection and bias dissemination? We know that we have an IRB process that helps us to try to eliminate the bias and protect subjects, but we know that each of us as individuals have our own implicit biases just from the structures that we are a part of. And so it's really important for us to pause and recognize those biases as we work with different populations, and consciously and deliberately work to unlearn those biases. And finally, what inequities need to be prioritized in your work? So thinking about your area of research and interest, where are those disparities that exist, and how can we make sure that we're intentionally designing our research around those as well? Next slide, please. So I just want to, again, encourage you as we move throughout this summit and as you continue through your work to kind of keep that equity lens in full view as we move forward, and we'll have prompts throughout the summit to continue to remind you to keep that equity lens framed. Next slide. Great, so thank you so much. We have just a couple minutes for any comments or questions related to my presentation before we transition on. So again, if you have questions or comments, feel free to post those in the chat. I see a comment from Lisa. When you look at the key areas for future research, what does meaningful and where does meaningful and purposeful respite activities fit in? I know for me, when Kelsey has beaded a necklace or painted a bird feeder, she is so proud. She is showing it to me when I first walk in the door. Seeing her so happy and proud reduces any possible guilt I may have from being away. Lisa, thanks for sharing that comment and question. I think that's a really important piece. I think that's really part of the recommendation number 2, which is about outcomes, and thinking about that as an outcome. We often think of the caregiver outcomes, and we want to focus on that as Respite's primary intention is to support the family caregiver and their outcomes, but we know that Respite can improve outcomes for the whole family, including the care receiver. And so I think that what you're describing here is really an outcome for your daughter, as well as an outcome for you, that you are feeling comfortable and trusting of that service, which is helping you not feel guilty and to fully benefit from Respite as well. So I think her happiness and her enjoying the Respite related activities that she's involved in is really helping to support your ability to fully benefit from Respite as well.